Greetings. This is the Deep Dive. We're bringing you the key developments and essential strategic insights from the period October 4th through 6th, 2025. Our focus today is squarely on actionable intelligence, particularly for you, the senior leadership operating in the South Asia region. So our mission here is to cut through the noise. We want to really focus on this interesting dichotomy that emerged from our sources. On one hand, you have these strategic achievements, big wins for organizations like UNICEF. But then contrasted very sharply against that are these critical, quite severe domestic events, particularly in India and Bangladesh, that fundamentally impact child welfare and operational safety.
Exactly. This three-day window, it really offers a crucial strategic view for you. We're seeing major long-term partnerships being cemented, things like supply guarantees, global digital pivots. But at the same time, the situation on the ground demands immediate attention. We're talking crises ranging from huge economic liabilities tied to malnutrition all the way to acute regulatory failures in the health system.
Okay, let's jump right into segment one then. The organizational momentum and specifically UNICEF's strategic wins. October 4th saw a really massive procurement success. This looks like it secures long-term stability in a critical public health area.
Yeah, we're talking about the major letter of award that Panacea Biotech received from UNICEF. It's for the supply of the bivalent oral polio vaccine, or BOPV. And this isn't just, a standard contract. It feels more like a strategic guarantee for the future.
Absolutely. It's multi-year, a long-term agreement locking in that critical supply, worth what, 315 crore, and running all the way through March 2030. That level of supply chain security is just foundational, isn't it, for maintaining momentum in regional polio eradication efforts.
And what's equally fascinating, I think, is this pivot toward global digital empowerment. On the very same day, October 4th, Big a leading universal exchange, announced support for UNICEF's first ever global game jam. Now, this sounds fun, but it's actually much more than just a virtual hackathon for young tech enthusiasts.
Right. It looks like a global blueprint for developing digital skills in the workforce of the future. The initiative targets participants under 21 across 8 countries.
That's right, spanning India, South Africa, Armenia, Malaysia, Brazil, Cambodia, Kazakhstan, Morocco.
So a really wide reach. It demonstrates that strategic shift moving beyond just health challenges to prepare adolescents for, well, the future digital economy.
And securing non-governmental funding is obviously still a high priority. We saw some pretty robust advocacy efforts rounding out the week, too.
Ah, yes. The MASH Ball 2025 in Mumbai, hosted by Shalini Pasi. That seemed to successfully merge high-end art and fashion with philanthropy.
Exactly. These kinds of events are crucial. They translate high-profile social capital directly into developmental resources. The MSH Ball specifically supported UNICEF India's child development programs. The goal, as Shalini Patsy put it, was simply giving children the chance to dream, express, and grow. And these philanthropic partnerships, well, they're often the essential lubricant for rapid response funding, especially when government resources might be slower to materialize.
Okay, so that's the strategic success side. Now let's unpack the other side of the coin. Shifting quite abruptly, really, from those long-term plans to the sobering reality on the ground. This brings us to segment 2. The evolving health crises. We're looking at environmental exposure and this nutritional time bomb.
The environmental toll in South Asia, it's reaching catastrophic levels,
Yeah.
especially air quality. If you look at the UNICEF Handbook on Children's Health, the data specifically on Bangladesh is, frankly, terrifying.
In 2021 alone, air pollution caused over 235,000 deaths there, and that includes a heartbreaking 19,000 children under the age of 5. Just staggering.
And remember, Bangladesh was ranked the most polluted country globally in 2023. Dhaka was the second most polluted city for several years running. This isn't just bad air, it's a pervasive systemic failure that needs massive infrastructure intervention.
And this environmental disaster, it isn't just about respiratory issues or immediate deaths, is it?
No, not at all. There's a new study, very relevant to India, that reinforces these long-term, possibly irreversible costs. Research is now linking Delhi's toxic air, specifically nitrogen dioxide and fine particulate matter, the PM2.5 MONDAC, to declining uncorrected visual acuity, UCVA, in children.
Declining eyesight in children because of air pollution. That's perhaps the most shocking data point this week. The environment is literally compromising a child's ability to learn and thrive by affecting their sight.
That deep connection between the environment and basic development is critical. But there's also this concurrent crisis emerging from within the diet itself. Researchers are calling it the double burden of malnutrition.
Explain that a bit more. What's the double burden?
Well, it's a major structural challenge for policymakers, particularly in India. You're dealing simultaneously with chronic undernutrition kids not getting enough food and the staggering rise of obesity and diabetes. The convergence of these two seemingly opposite pressures creates what looks like an unmanageable future healthcare liability.
And the timeline for this tipping point isn't far off, is it? It's happening now.
Exactly. The UNICEF Child Nutrition Global Report confirmed it. For the first time, in 2025, the global prevalence of obesity among school-aged children and adolescents actually surpassed the levels of underweight children.
Wow. And the economic implications.
They are massive. And this is where you, as senior leaders, really need to focus. The World Obesity Federation forecasts India's obesity-related costs will skyrocket. They estimated jumping from nearly $29 billion back in 2019 to a projected $839 billion by 2060.
$839 billion. That's nearly $1 trillion.
Yes, representing 2.5% of projected GDP by then.
Yeah.
It's a fiscal time bomb. It genuinely threatens the sustainability of future economic growth.
And the causes are systemic. I saw a mention of the UNICEF report Feeding Profit.
That's right. That report warns that children are being, well, relentlessly targeted by the ultra-processed food and beverage industry. This is deepening the nutritional crisis, especially in this digital age marketing landscape we live in.
Okay. So, if environmental and nutritional pressures represent a kind of slow, chronic exposure and a systemic liability, let's shift now to segment 3, the acute safety failures. Immediate regulatory gaps that tragically cost lives.
Yes, this period was unfortunately marked by the cough syrup poisoning tragedy. The death toll climbed, very sadly, to 12 children across Madhya Pradesh and Rajasthan. What makes this a particularly complex regulatory disaster is the immediate contradiction. Initial samples that were analyzed found no toxic contaminants, yet the deaths continued.
So that signals either a very localized failure, maybe contamination in one batch, or perhaps a challenge in identifying the exact systemic breakdown point in testing or ingredients.
Precisely. It caused understandable alarm and drove immediate necessary action. MP in Kerala moved quickly to ban a specific brand. The center stepped in to inspect pharma units. And critically, the Union Health Secretary, Punya Salila Srivastava, urged all states and union territories to strictly comply with the revised Schedule M.
That's the updated good manufacturing practices, the GMP guidelines.
Exactly. This tragedy just underscores the urgent need to enforce basic quality controls in the pharmaceutical supply chain, a chain that is clearly, in this instance, failing the most vulnerable.
And alongside this specific tragedy, we also have deeply troubling data pointing to more systemic gaps in child protection. This comes from the National Crime Records Bureau, the NCRB, for 2023.
That's right. Crimes against children reportedly increased by 9.2% overall.
Which is evidence of that systemic gap you mentioned.
Yes.
And specifically on child marriage.
Yes, this was striking. While some narratives might suggest a decline, the actual registered cases under the Prohibition of Child Marriage Act jumped 6 times in 2023.
6 times? That's enormous.
It is, and Assam accounted for nearly 90% of that total. Moreover, the sources revealed nearly 17,000 girls were kidnapped, specifically for the purpose of marriage.
So there's a huge disparity between perhaps public perception or broader trends and the sharp increase in registered crimes. Enforcement seems to be lagging way behind the reality on the ground.
And we also have to acknowledge the immediate human cost in individual cases. There was that tragic Faridabad case. A father hanged his 3 children, 2 died, before taking his own life. He apparently blamed severe mental trauma connected to his in-laws. It's just a stark illustration of how family crises, when compounded by mental health strain, can intersect directly with child safety, demanding much better, specialized psychosocial support structures.
And speaking of needing immediate intervention and support, we saw the judicial response to the Karur stampede that tragically killed 41 people. The Madras High Court called it a huge man-made disaster and ordered a special investigation team.
Yes, and this is a critical moment where we see UNICEF guidelines being explicitly called upon and potentially operationalized. Following that disaster, the Tamil Nadu Psychologists Association directly cited UNICEF guidelines for emergencies. They urged authorities to enforce stricter safety measures, yes, but crucially, to provide immediate counseling and emergency psychosocial support. The need for scaling up the specific capacity psychosocial support in the aftermath of man-made disasters feels immediate and vital right now.
So, what does this all mean when you put it together? Let's look at the broader landscape, the future engagement points in segment four. Despite these significant operational headwinds, pollution, safety failures, UNICEF India is still making strategic investments in future resilience.
Exactly. You could see it as a counter-strategy, building capacity precisely where the current systems are showing strain or failure. On October 4th, UNICEF India launched the country's first ever Child Protection Innovation Fund, the CPIF. This feels like a very forward-looking step, aimed directly at addressing the gaps we just discussed, the ones shown in the NCRB data. Things like strengthening the child protection workforce, improving access to social protection schemes, supporting adolescent girls, promoting online safety.
And collaboration seems key here. We noted the CEO of SRP, that's the Society for Elimination of Rural Poverty, a key government body, Divya Devarjanjan. She was meeting with adolescent girls from these SNEH groups, right? Focusing on safety, nutrition, empowerment, and health.
Yes, and she emphasized that girls must prioritize economic independence and social respect. This kind of targeted intervention is critical if you want to break the cycle of vulnerability, especially the kind we see reflected in those child marriage statistics.
We also saw the strategic channeling of corporate resources coming into play.
hmm The Indian Institute of Corporate Affairs, ICA, is hosting the second national conference on corporate social responsibility, NCCCSR. And the theme is very specific, leveraging CSR excellence for tribal development. Okay? You see UNICEF actively participating there, alongside major organizations like TriFed, HCL Foundation, IOCL. It points to a systematic effort, doesn't it, to try and direct private capital towards particularly vulnerable, often underserved populations like tribal communities.
Finally, though, we have to acknowledge the persistent regional risks. These aren't happening in isolation. There were concurrent humanitarian challenges just outside the immediate India policy focus, but demanding regional coordination.
Absolutely. The Darjeeling deluge killed 18 people following landslides, and intense rains in Nepal claimed 52 lives around the same time. It just reminds us that the overall scope of environmental and disaster response required across South Asia remains vast and immediate.
So let's try to connect this all back to the bigger picture.
Well, the events of these 3 days, they really illustrate a kind of dual reality for organizations like UNICEF operating in the region. On one hand, they're successfully building institutional strength. You see it in locking in that long-term vaccine supply, leveraging high-profile digital partnerships like the Game Jam. But even as they do that, the operational environment demands urgent, constant attention to these severe domestic crises. We're talking massive environmental liabilities, the nutritional time bomb we discussed, and these systemic failures in regulatory enforcement, whether it's drug quality or child safety.
So for you, the senior leadership learner listening to this, these sources really show that organizational strength is being built. Platforms like CPIF, global initiatives like the Game Jam, they're happening. But the immediate, clear, and present danger remains domestic safety and environmental exposure. The central strategic challenge seems to be figuring out how an organization can rapidly scale up things like psychosocial support, how to deploy emergency guidelines effectively, especially when man-made disasters like that stampede and chronic environmental crises like the pollution epidemic consistently intersect to harm children. How do you respond fast enough and effectively enough?
And this really raises an important question, perhaps, for further consideration. Given that clear, undeniable link we discussed between severe pollution and child health outcomes like eyesight, and given the urgent need for better safety enforcement, highlighted by tragedies like the cough syrup deaths, what is the responsibility then of those large corporate partners, the ones involved in the CSR conference or sponsoring the Bitchy Game Jam? What's their responsibility to address the critical infrastructure and environmental safety failures that are detailed in these reports to ensure their strategic engagement truly impacts the core causes of child vulnerability, not just the symptoms?